Hey, everybody. Thanks for joining me this evening. Can you hear me okay? Give me a thumbs up. All right, I see some thumbs up. That's good. Hello, hello. It is 7 o'clock, 7:02 Mountain Time. I'm sure we'll have some stragglers coming in here over the next few minutes. So we're going to allow that to happen. So since we're already recording, thank you for your patience. Um, when you see me do this again, if you want to fast forward through this part where we're waiting, go until you see this again. And that means we're good to go. Hope everybody's having a great week. Tuesday, February 18th, 2025. Cold as ever outside. It is a balmy 9 degrees at my house. I'm guessing if you're up the hill, which means in the mountains here in Colorado, it's actually warmer at your house. That's a possibility here today. Love that inversion. I love that for you all, you mountain peeps, you mountain dwellers. All right, I'm going to get rocking here. And as folks pop in, they'll pop in. So here we go. Double thumbs up. Here we go. This is part two of two for medical issues in trail and ultra running, our February 2025 clinic at the Human Potential Running Series. Thanks so much for joining me. I want to remind folks that our next clinic is next month, and we will be heading back to one of our most popular clinics, the Trail Runner Navigation Clinic. It is $50 per person. REI used to host REI used to host their own for like $80 to $100, depending on the REI you were at. I think it's a pretty good deal. It is 4 classes, 7 to 9 p.m. on Tuesday nights. There's one week in there. I don't know what night it'll be yet. But for the most part, we'll be 2 hours on Tuesday nights, 4 different classes. And there's a few folks who have taken this class in this clinic here. I see Amy giving double thumbs up. I think it's a great class. Honestly, I think it's the best clinic that we have. So if you don't know how to read a map or use a compass or both, and if you want to know some information on how to use GPX, online mapping software, things like that, I welcome you to please join us. In April, we're going to have two clinics. The first one is this Wilderness First Aid Certification course. Again, during the last class, a number of you indicated that the reason why you were engaging with this clinic in particular is because you wanted to learn how to fix yourself or fix other people that you may come across on the trail. And I hate to be the bearer of bad news, but this is not something that you learn over a 2-hour webinar. It is not something that you learn over two 2-hour webinars. This is something that you actually learn over 16 hours of in-person teaching. And that is what the Wilderness First Aid Certification course is for. Again, the cost of this is $325, taxes and fees. It comes out to be around $340. It's being hosted April 5th and 6th in Lakewood. It's like Lakewood, Wheat Ridge, Denver border area. 6th Ave and Kipling area. We'll be at the Boy Scout office there for this clinic. Space is limited. I think I have room for 6 more people, and then we're sold out. So if you really do want to learn how to fix people, fix yourself or fix others, this is the course that you want to take. And also in April, we're going to do a one-night freebie clinic, a webinar on our HPRS Facebook page on drop bags. So I look forward to sharing all of that with you all when the time comes. So tonight, class 2, bleeding but not dead. Let me get into my, here we go. And here I am. Bleeding but not dead. Again, this is me. I've got some experience, blah, blah, blah. Class 2, bleeding but not dead. This is show and tell tonight. We're going to be exploring the most common injuries we see at HPRS, including breaks, sprains, abrasions, rashes, and fixing your feet. This will be a show and tell clinic. I'm going to show some photos this evening. Those of you with a weak stomach may not enjoy all of the photos. I will be sure to give warning before I show one of those pictures. I will show the injuries we have seen, and I'm going to tell you about how we responded to those. I will also show the things I would keep on me as a runner in the event of an emergency. So I'm going to show you some personal first aid kits that I have. Turns out I have 3 different first aid kits I get to pick from. And I'll show you what we have in our HPRS race first aid kits that are in our aid stations. And then I'm going to show you my race director's first aid kit as well. We're also going to talk about feet. I'm not going to be popping blisters and showing you how to apply moleskin this evening. I do have a video to show you about moleskin. I am going to use some of my technology here to talk briefly about blister care during a race to help you out with some of that. I'm going to be sharing a tremendous resource with you. It's a book. Discuss preventative measures for your feet and discussing what to do should foot issues arise. We could spend hours on feet alone. And I'll also be discussing the realities of what happens if you are injured at a race, which includes how we respond at HPRS, what happens if we require assistance from state park staff or other land managers, what happens if we call 911, the realities of search and rescue. My goal is to bring the reality of emergent situations in trail and ultras to the forefront of our conversation so that we can all appreciate the necessity to care for one another, care for ourselves, and to be responsible explorers. And just a note, friends, again, specifically, we will be showing and telling about injuries we have personally seen at HPRS. I wish we had the time to allow everyone here to have the opportunity to show a picture of your own injuries and tell us your story. If I've learned anything in 11 years of race directing, it's that runners just love to tell you the story about that time that they broke their ass on something. It's cool and all, but we'll be here all night if we just have this free-for-all of people telling their personal stories and one time at band camp and all that. So we're not going to do that. Thank you so much for understanding. I think we can all agree that we'd get off the rails pretty damn quickly if we did that. So I want to respectfully request that those in attendance tonight, please resist the urge to interject with your own tale of woe. This one time I was running and I fell, and an hour later, I actually think I might have a song for that.
1 hour later.
Yeah, we're not going to do that. Well, I appreciate that we all have a myriad of stories to share about injuries. It's not the intention of the clinic. So thank you for your cooperation and understanding. Okay, let's dive in. Hey kids, I don't know if you know this, but the number one job of the race director is risk management. Yes, ma'am, risk management. And risk management actually starts with you, the runner. As I say in my pre-race meetings, you actually need to be properly trained to run in these events. So the couch to 100 mile, probably not a good idea at HPRS. You also need to know your own limitations. I know that we're in a sport where we try very hard to find out what our limitations are and to break down those barriers and push through to discovering a new limitation. And that's all fine and well, but we need to do that under the guise of personal responsibility and understanding that, again, if it's not your day, it's okay to live to run another day. You also need to have the right gear. You need to, and I want to be clear that you folks know your body better than we do. Okay. You know your body better than I ever will. So I'm going to tell you, years ago in 100-mile races, we used to have to weigh in at aid stations. There were mandatory weigh-ins at multiple aid stations along the course of a 100-mile race. And the thought behind that was, if you are gaining weight or losing weight during the course of an ultra marathon, and it's like significant weight, up or down, that there was some kind of correlation to your overall health that the weight gain or loss was kind of indicating. And so you'd go into an aid station and you'd step up on a scale and they'd weigh you. And if you were a certain percentage of your body weight higher or lower, um, they're going to sit your ass down and you're just going to watch time tick by until you either eat and drink a lot or you pee and poop a lot. Whatever it is that you need to do. Some of us runners, I'm sad to admit, if we thought or suspected that our weight was going to be down, we would actually pick up rocks, put them in our pockets, and then run into the aid station and step on the scale, hoping that those rocks would add the weight that we need to not trigger a sit down. The other thing that I learned in the years that we used to do that is that somebody who's a medical doctor in a hospital, works in like the ER or does pediatrics for a day job, and all of a sudden they find themselves at a 100-mile race looking at these stupid runners do this crazy shit. They honestly have no idea what you're doing. They have no idea what your body's going through, and we knew our bodies better than they did. But here they were practicing. That's a key word. Practicing medicine out at on an ultra marathon running course. Anyway, Western States 100 did some research and found out there's no correlation between weight gain or loss and your general health during an ultra, so we don't do it anymore. So we haven't weighed in at ultras since like 2016, I think was the last year that that folks did it. However, there are still some races out there who engage in this practice, and I stay away from them because that tells me have no idea what they're doing. The other big thing with the risk management is you folks are our eyes and ears. We rely on you to let us know what you see and hear out there, what's going out on the course. So if you see, this is why I always stress, if you see a runner tying their shoe, stop and check in with them. Have a conversation. Did they seem to be with it, or are they way out in the weeds? What can you offer them? How can you help them? How can they help you? What can they offer you? Either way, when you get to that next aid station, you are our eyes and ears. So you're going to be able to report to me or any of our aid station staff, hey, I was just running and there's a runner back there wearing blue shorts and a red top, and they just, something seems off with them. They don't seem to be with it. They're coming in, but you might want to check on them when they get here. And we're going to actually write a note and check on that runner when they get into the aid station. So very important that if you see something, you say something. If you hear something, you say something. But most importantly, what is your plan? Do you have a plan in the event that something happens to you out on a course? There is a gentleman named Jed Williamson who writes a book called Accidents in North American Mountaineering. He's been doing this for decades. I had the opportunity to see him and listen to him speak, and he offered these two quotes. If you fail to plan, you should plan to fail. And the other quote that he gave, which made me chuckle, and I still love it, there's no such thing as bad weather, just bad preparedness. We live in a time when there's so many pieces of gear that we could buy and wear to handle the elements that perhaps folks who get into trouble when there is bad weather, it usually is not the weather. It is their level of preparedness. I want to take a moment and go back to something I said during our last clinic. I got something on my hat. Okay, we got it. Something we talked about at the last clinic, and what I said was, if it's below 40 degrees, please stop being the runner that shows up in short shorts and goes out for a run. And okay, so story time, just a little story. This past Sunday at the Stories Trail Runs, it was a very frigid day. We got to a high of 36 degrees. there was a young gentleman who I would say was probably in their 20s running in the event. His dad was also running in the event. Dad finished ahead of son, but when the son finished, he was in stage 2 hypothermia and he was wearing a pair of short shorts. It didn't get above 36 degrees at the race this weekend. When the son came across the finish line, we ushered him over to the fire and tried to get him warm by keeping him near the massive bonfire that we had going for 2 days. And it did not work. It did not help. So dad decided we should probably get going. Let me get you in the car and turn the heat on. But as dad is walking his son away, I approach to check in, and dad is, oh, he's fine. He's doing great. He is not fine. He can't even, his teeth are chattering so hard he could not get words out. This is stage 2 hypothermia. Why does he have stage 2 hypothermia? Because he was wearing fucking short shorts. Stop it. Be prepared. Have a plan. You need to have the right gear. I swear in this moment, because there you go. There's the beeper. It's at the wrong time. I swear at this moment because nothing angers me more than people who could have prevented the situation entirely by wearing the right gear, by not, I don't understand what was the point of wearing just shorts. You've got 3 layers of clothing, a jacket, a winter hat, gloves on, and a pair of short shorts. Tell me how that makes sense. I don't understand it. And it makes me angry because if I have to respond to somebody who is doing something that could have been entirely avoided, it's taking me away from being there for everybody else. It's very selfish. It's unnecessary. So I'm sorry if my anger comes across with that and my frustration. It is what it is. Use your brains. Use your noodles. Okay. So here's the race director's plan. The first part of my plan is the emergency action plan. And that is EAP, emergency action plan. Sometimes it's referred to as the emergency response plan or the ERP. And this plan goes into great detail how we will respond to specific situations. An EAP is required for our permit. It is a part of our permit. It talks about the personnel on site, who will be on site, who are we calling in the event of an emergency, when are we calling them in? It's going to detail the communications chain, the equipment that we have on site, like our first aid kits. It's going to detail the plan if we need a medevac via helicopter. It details storm safety, wildfire, sometimes active shooter. And it includes maps and egress on how we're going to get folks out. Now, here is what our race drives look like at HPRS. And within our race drive is our EAP. And it's right here. And this is what it looks like. I share this in the runner's drive for every race so that all of our runners will know exactly how we are going to respond in the event of an emergency. So this is the EAP for Silver Heels, a 100-mile race that travels through 2 different United States Forest Service national forests, 3 different ranger districts, 2 different counties. So here I've got Ranger District, Colorado Highway Patrol, State Patrol. I got the 1 county sheriff, another county sheriff. I've got all of the different fire stations who could possibly respond in the event that an emergency transpires, how to get a hold of them, the specific address they will be coming in from. The ambulances up there come via the fire districts, who the different search and rescue personnel are, and where the nearest medical facilities are. And then it goes into great detail, as I said, our personnel, how we're going to activate the emergency medical system, directing paramedics to the scene, the protocol for this emergency medical system activation, transportation, communication, the equipment we have, helicopter, what the staff will do. And then there's a storm safety plan. What if there's a tornado watch or severe thunderstorm warning? What are we going to do? How long do we wait before we cancel the event? This event will be canceled if one of the following conditions exist. Who has the authority to cancel or delay the race? Is it me, or is there anybody else involved who can cancel or delay? And how are we going to broadcast that information to our participants? If we get to a point where we have to cancel or delay, how are we going to get that information to you? What if a wildfire sparks up on one of our courses? And then we have to provide a map of the venue. So I'm going to scroll a little bit down here. Here's one of our maps. The black arrows on this map show exactly the route of egress from each area on the course. And then each of these colored boxes correspond with the discussion up above. So this is a pretty thorough and robust plan. There's more. You can see rally points on here. They're the little arrows, little arrow there. Little circles. These are all the various rally points. And the discussion discusses how we're going to get to those rally points. And then this continues for every single part of the course. Usually on these maps, we also indicate helicopter landing zones in the event that we need a medevac. Then each aid station has the location of the aid station via GPS, how far away is the nearest hospital, who's responding to search and rescue, what is the nearest medical center, and directions on how to get there. And then we've also included this map and where is the nearest cell phone reception for this aid station. So this one says either side of Kenosha Pass, about a mile away, north or south, have service, but there's no service at the pass, which is odd. But we have one of these plans for every single aid station at the race. I want to go up. We're going to go in a little bit of detail here, but we do have a protocol that we have to follow for unaccounted for runners. So this is, what do we do if somebody missed a cutoff or if we actually don't know where a runner is? So this is a pretty in-depth plan that we do follow. And it always starts with notify the race director. So you see that here, notify the race director. 2 is gather information. And then from that information, we pick a direction. And we also have a protocol for a medical or a rescue incident on the course as well. So what are we going to do in the event that there is a medical or a medical incident or somebody actually needs rescue? Maybe you're having a cardiac event and we need to come and get you. What exactly is going to happen? So this is all detailed in our EAP. And again, every single aid station has a copy of this. I have a copy of it on my person at all times at a race. All of the associated land managers have a copy of this plan. I may have also given this plan to every single firehouse or any EMS that might respond to the event. They also have a copy. Search and rescue has a copy. Everybody has a copy, so that in the event that something happens, every single person who would be involved in our response has a copy of that plan, and we all follow the plan. The other things that we have here at HPRS is we have a medical volunteer manual that all of our medical volunteers get. And then we also have a psychological first aid plan that our medical personnel reads. If you don't know what psychological first aid is, I'll tell you. In the sport of trail and ultra running, mostly in ultra running, I will tell you that a majority of the folks who are running ultras tend to be here because they're working through something, some kind of trauma. Maybe you're a recovering alcoholic. You're recovering from some other kind of addiction. Maybe you suffer from PTSD, or maybe you suffer from major depressive disorder, anxiety, or something to that effect. I need to have a plan in place on how I'm going to treat you if you're having a psychiatric event. How am I going to offer you love and compassion and empathy while also trying to make sure that you are safe, my volunteers are safe, and all of the other runners are safe? And so that's where psychological first aid comes in. I mention it because it's often overlooked. And I want to make sure everybody knows that that's actually also an important piece of the puzzle. So that's all a part of our EAP. And so again, I talked about the missing runner protocol, which is how exactly we will respond in the event that a runner has gone missing, and that includes search and rescue. And there's an injured runner protocol, how exactly will we respond in the event that a runner is injured. Then there's our medical volunteers. Who are our medical volunteers? And I want folks to hear that it is not often in the sport of trail and ultra marathon running that an ambulance is actually on site. That is rare. That actually is something that is pretty seldom seen in our sport. So this is why our medical volunteers are so important at our races, and they're actually the hardest people to find. At HPRS, we require every medical volunteer to be either a registered nurse, licensed nurse, so RN, LN. You're either certified in wilderness first aid or wilderness first responder. You might be an MD, you might be a physician's assistant, you might be an EMT or paramedic. Sometimes I do also take physical therapists or athletic trainers because they have a tremendous amount of training as well, and they can help out. But it's not just somebody who's like, I'll be the medical person. I know how to put a band-aid on. Not okay. Not nearly enough. So then we have our aid stations have first aid kits. I'm going to show you what ours look like. Every single ultra marathon makes their own. There is no standard first aid kit. Um, we make our own. Some races will buy their own. And then I have my own first aid kit. In general, first aid kits are useless if someone doesn't know how to use what's inside them. And then there's certifications. And I want folks to hear that it is not a requirement that the race director be a woofer or woofa or have any medical training to get a permit. I always tell folks, Grandma Gertrude can get a permit to put on a race and can have absolute zero medical training. And if something happens to you, they have no clue how to respond or what they're doing. And to me, in the trail and ultra marathon space, I personally believe that all race directors should at least have a wilderness first aid certification. For me, I have a woofer, wilderness first responder. That's the next step above. And then I also have this certification in risk management for outdoor programming. I also have a certification for to be a professional race director, and I highly recommend that race directors have at least one of those so that they understand the importance of their job and what exactly they're responding to and how to respond in the event of an emergency. If a race, a lot of folks and some race directors, they really do believe that they're just party coordinators. My job is to hang ribbons, get a permit, get insurance, hang ribbons, say go. Yay, party time. Um, no, you are number one. If something happens to somebody, they're relying on you. So here's what an HPRS first aid kit looks like. This is a hub kit. We have some kits that do not say hub on the corner. The hub kit is the kits that we're going to put at aid stations where medical personnel will be at. If there's not going to be licensed or certified medical personnel at an aid station, I won't provide this. They'll have a first aid kit, but it won't be as robust as this one. And the reason is, again, if you don't know how to use a blood pressure cuff, why would I give you one? If you don't know what a pulse oximeter is showing you, why am I going to give you one? So these are important things to think about. So in this hub kit, we actually have a blood pressure cuff. It's an automatic cuff, and this one you actually put on the patient's wrist, hit on, and it'll get a blood pressure reading for you. Blood pressure isn't something we take one time and then we're done. It's you take it every 10 minutes. Pulse oximeter, this will tell me your pulse. It'll also tell me your oxygen intake. Tells me if you're getting enough air in and if your brain's working, right? Talked about that in the last class. The vital role that oxygen plays in your ability to do this thing. So we have a pulse ox. I also have a tourniquet. These little tourniquets are actually you could administer it yourself. But this is our tourniquets that we use to stop severe bleeding. There's also this pre-wrap stuff. We got some medical tape. These are not for your bibs, they're for popping things. Let's see, I got some Tums. I've got medical grade scissors. Great for trimming your beard hair, too, by the way. Also have these tweezers, medical tweezers. We've got some uh, tongue depressors and more of this wrap that's awesome. There's also going to be some latex gloves in here. This got some snow in it this weekend. That's why we got some water dripping out. That's not good. Okay, so that's the top layer of this kit, which is a toolbox. So I remove that or this fucking wrap. Okay. A triangle in case you dislocate your shoulder, break something. We got a pad of paper for your medical person to take notes. Also, let us know what was used from this pack. We've got some cold packs. I also have some gauze. I have these are shears that the ambulance people have as well. This is to cut your clothes off if we need to get some clothes removed. We have a SAM splint. We have extra batteries for our blood pressure cuff. I've got povidone iodine swab sticks. That's for cleaning your wound. I also have ABD pads. More latex gloves. There's so many latex gloves in here. That's so I don't get your goopy whatever on me. Then we have this kit inside this container. I've got band-aids of various sizes. I've got ointment. I've got big band-aids, little band-aids. I've got gauze. I've got sterile alcohol pads. I don't even know what that is. It's an antiseptic towelette. I've got, yeah, just different sizes and types of gauze that I can stop you from bleeding with. And so that's all in here. And then I also have this little guy has Benadryl, Tylenol, and some cotton swabs. Um, and then I have another little container here that has sting relief in it and other drugs. No Quaaludes. Bummer. Um, More ointments, burn cream, you name it. And everything is in these little plastic pouches because these are all things that we want to keep somewhat sterile. If you're going to ingest them or we're going to use them to clean up something that occurs to you. That is the HPRS first aid kit. That's what we have. Now you're probably saying, John, I was expecting more. If you are having an issue where we needed more than what is in this box, we're calling 911. That is why that is all that is in this box. Anything beyond that box is going to fall on me. Race corrector. This is my personal first aid kit that I carry with me around every race. It has everything that I just showed you inside that aid station first aid kit. Um, with some other fun things in here. These are for airways. If I need to open up an airway, I'm putting one of these plastic things down your throat. I've also got ibuprofen, afterbite. I've got a Narcan. You guys are probably like, really, John? Somebody's going to be overdosing at one of your races? My friends, you would be surprised the shit that I have seen at my races and the various levels of with it or not with it that I have seen some runners showing up at our events. And no, I would not second guess that I might have to use a Narcan someday. I've got wound sealer. I've got tick removal. I've got these syringes in here so that I can irrigate and flush out some of your wounds. I have my own iodine. I also have medical tape, various sizes of medical tape. I have finger splints, finger splints. This is new skin. It's a roll of skin. Like if you get a tattoo nowadays, this is the stuff that they're using. They're actually, they will unroll a section of this and cut it to size and then slap it on top of your tattoo. And that seals your wound closed so that the serum from your body will heal it itself over the course of many days. So this is what the tattoo folks are using nowadays. There is even a picture of a dude getting tattooed on here. It's not for tattoos at a race. By the way, I've noticed that there are some races that are doing tattoos at finish lines. Looking at you, Cocodona 250. I can't even begin to tell you how irresponsible that is. Um, if you've never seen pictures or videos of an infected tattoo, jump down that rabbit hole, friends. The finish line of an ultra is the absolute last place you should be getting tattooed. Okay, then I have this. This shit's fun. Here's one. Skin on skin. This is a goopy skin thing that I can peel off and slap onto your wound and close that up. And then I'll put a band-aid or something over that. And now we've got new skin. This is the stuff that I keep in my first aid kit for races so that if anything happens to you all, I am able to help you out. I'm able to look in here. I've got a stethoscope. I've got my own Sam splint. I've got my woofer cheat sheet in case I forget anything, because there's a lot to remember. So if you're having an issue and it's, oh man, what am I going to do? I can flip through this book and just get a quick reminder on what the hell I'm doing with anything that I might management of a crucial ligament test. I can find out how to test your ACL, PCL, LCL, or MCL for figuring out if you tore shit or not. Like that's the specified training that I've received, and sometimes it's hard to remember it all. So I got this little book. I also have my soap notes. If something ever happens to you, I'm going to be asking you a ton of questions and filling it out on this soap note. And then I'm going to continue to ask the same questions every 10 minutes as long as you're in my care so that I can continue to monitor the situation and your condition. Okay. So that's what's in my kit. And I keep adding to this kit. I keep putting things in it all the time because I want to be there for you. So that's what's in our first aid kits. Now you know. So now I'm going to jump to what happens. What happens? So here's my plan. Again, before we ever call 911, I want to tell you that I'm going to use Sawmill as my example. Okay. Sawmill trail runs. This was back in December. A runner came into the finish line area and reported that there was a runner about a quarter to a half a mile out from the finish line who had badly rolled their ankle and were in need of assistance. And the runner who was reporting that information to us was a little bit frantic. So for me, the frantic nature of that person and the report they gave made me believe that this was a truly emergent situation. That runner needs immediate medical care. The next runner that came in also reported that there was a runner about a quarter to half a mile out from the finish line who had badly rolled their ankle and they are in need of some assistance. But they were not frantic. They were totally chill and calm about it. Suddenly, it didn't seem like it was an emergency. So, as a race director, I have two reports, and both reports are very different reports. I have the same report of an injury, a badly rolled ankle. I have the same information that that runner needs assistance, but I have one person told me of this incident in a way that made me feel like they're about to lose a leg, and I had another runner that was like, it's not a big deal. They just need help. Now I'm relying on the third runner to come in and give me information. And the next runner that came in and reported the injury, also runner, badly rolled ankle, sitting on a bench, appears to be fine, but definitely needs some kind of assistance. They're not getting out unassisted. Great. It's not a huge emergency, but that person does need assistance. So the reports are coming in. All of the reports differ. As the race director, I need to determine the severity of what is going on. And then the response to that injury is going to be determined by either myself or the medical director if a race has one. We don't have a medical director at HPRS. I'm the closest thing to it. So I determine what the response is going to be. In that case, it was, okay, I've got two young volunteers who I know can get to that runner in a hurry. I call this a hasty crew. I'm going to send a hasty crew out with a small medical kit that included a SAM splint. I handed it to those volunteers and they said, John, we actually don't know how to use a splint. We don't know how to splint somebody. Okay, great. Well, I'm not going to give you this because you don't know how to use it anyway. But what I would like you to do is, as quickly as possible, go out to that runner and assess the situation. Give me a call. Let me know what you see. But ultimately, I would like you to try to get that runner in to the closest parking area. If you can do it via buddy carry, that would be best. Okay, great. Those two guys head out down the trail. They get to the runner. The hasty crew is dispatched. They gather more information on site. My phone rings and they tell me, here's what's going on. The response is going to morph based on what my hasty crew finds, what information is provided to me. In that moment, we determined that the runner had a badly rolled ankle, possibly broken ankle. The two gentlemen that I had sent out attempted to do the buddy carry, which is one of these volunteers under each arm of the injured, and they're going to like limp him out down the trail. And this runner refused a buddy carry, refused the buddy carry, and instead demanded an ATV. By now, his sister-in-law had also arrived on scene, and she also demanded that an ATV be sent in. Okay, so now I've got a runner with a possible broken ankle, refused to engage in a buddy carry. They want an ATV. So what do I do next? The next thing I did was drive down to the visitor center and tell the staff there that I had to ask them, do you folks have an ATV that I can use? I have a medical emergency that needs a response. Then they said, what's the emergency? Now I have to relay to them the information that I have. And they say, okay, we'll have to call our ranger in. So now they pick up the phone and they call, and then the ranger drives in. The ranger arrives and says, what's the situation? So now I have to relay again to somebody else. This is the situation. They're requesting an ATV. Do you have one? And the ranger's like, yeah, we have one. I need to see where it is, how we can get it here quickly, and get that for your use. And then my phone rang again. And when my phone rang, it was, hey, Turns out that runner's sister-in-law has one of those pull carts from Walmart in her truck, and she just pulled that up the trail, and we put the runner in it and dragged him out on it, and he's at the parking lot in the car. Awesome. I looked at my Ranger and said, okay, never mind. We don't need an ATV. The runner has been extricated. He's in the parking lot in a vehicle. I'm going to go check on him now. I'll write a full report and let you know how it goes. I get in my truck. I drive up. I see the runner in the back of the car, and his sister-in-law, first thing out of her mouth is, "You guys really need to work on your response time." Friends, from the first runner who reported the injury out on the course to getting that runner to a vehicle in the closest parking lot was a total of 35 minutes. That is beyond spectacular. That is best case scenario. That is, you're not going to find that in too many places. That is quick. That is damn quick. 35 minutes from report of injury to getting runner to a vehicle. That is outstanding. Our land managers think so as well. Because here's the reality. If I call 911, and I have to relay what I know to dispatch. Dispatch is then going to call 911. At Sawmill Trail Runs, we're talking about the nearest fire department, which is in Conifer. They're going to ring the bell in Conifer. If it's not a volunteer fire department, then firefighters are on scene and they can begin coming out right away. And it is a 20-minute drive one way for them to get into the park. So already, from the time that I've called 911 until help arrives is at least 25 minutes. If it's a volunteer fire department, dispatch is going to run the signal, the bell's going to ring, and all those volunteer firefighters have to come in from somewhere else. They literally have to drop what they're doing, get in their truck, drive to the firehouse, get in that truck, drive out to the race site. We're talking 35, 40 minutes for a volunteer fire department to arrive. So this is what I say, like, if we have the tools to respond and have that runner to safety within 30, 35 minutes, that's huge. The other part is, if we call and let's say it's a search and rescue team that's going to come out, or even the fire department, they're going to come out. They're not coming in on an ATV. They're going to walk into the runner. They're going to assess the situation. The first thing they're going to do is the same thing that we tried to do, which is a buddy carry out. If you can walk, if you can hop, if you can hobble, that's what you're doing. You're not getting a ride. And I think a lot of people believe that I'm just going to call 911 and they're going to drive the ambulance right down the single track trail and pick you up and put you inside. That's not what's happening. In fact, if you require a litter carry, which is putting you on like a stretcher or a type of backboard, they're going to wrap you up in all kinds of like the warmest things that they have. They're going to strap you to the board so that you don't fall off of it. Even if they drop you or you get tipped to the side, they're going to make it so that you cannot move. And that takes time. So if the fire department determines that you can't walk out on your own accord or you need to be assisted out, that takes even more time. The other things are I have to call the land manager and they're going to come and respond. Then we need to figure out like whose jurisdiction is it? Are we in a metro area like at Cheyenne Mountain State Park? Well, we're in Colorado Springs. Are we? Or are we in unincorporated El Paso County? And that matters because the response is dictated by whose jurisdiction that it is. So I would say we'd probably get the fire department from Fort Carson to come up the hill. And then they're going to have to go out on the trail to find the runner and to meet you where you're at and then reassess. All of these things take time. We also need to return, myself, the race director, or the land manager, we're going to do everything we can to potentially move you to a better or safer location for medical response. So if we can get you to a place where an ATV can reach you, if we can get to a place where a vehicle can reach you, we're going to try to move you and get you to that place so that we can get you out even quicker. But again, the more hands that need to come in, the further away that you are from a road or a trailhead or the start finish line, the longer the response time is going to be. The other thing is, a lot of folks think that I'm going to call 911 and a helicopter's coming right away. Helicopters are a last resort. Helicopters are actually an incredibly dangerous vehicle to use. They are dangerous. They crash all of the time. They are a last resort. They are only used for the most emergent injuries. And when I say most emergent, I mean life threatening. You might die is okay, we need a helicopter. If you might not die, if we determine that you're not going to die, no helicopter's coming, and it's going to take a long time to get you out. Also, helicopters are weather and daylight dependent. A helicopter coming into the forest for a rescue operation, they need line of sight. They need to be able to see their surroundings, if there's any down trees or wires or power lines or anything, so that they don't hit it. And if they can't see those things, they're not flying. They're also not flying in the rain. They're not flying in overcast. Again, they need line of sight the entire time. So if the weather is not ideal, the helicopter is not coming. Search and rescue. This is also another situation where response time varies. What it's going to happen is I'm going to call 911. 911 dispatch is going to call search and rescue. All the search and rescue teams in Colorado are volunteers. They're going to drop everything that they're doing and go to the main spot where their gear is. It might be at home, maybe it's in their vehicle. It could also be at the shed, wherever their home base is. Then we're going to have to determine a meeting location. So the incident commander for search and rescue is going to be the first person that comes to me, and we're going to determine the meeting location and the meeting time. And then that plan is relayed to those volunteers. They're going to meet at that location. We're going to relay the plan that we came up with for course of action with what we're dealing with. And that plan is either going to be on foot or it could be via ATV. Once they arrive on the scene, wherever you are, they need to assess scene safety. And the first part of scene safety is keeping the rescuers safe. So they're going to worry about themselves first. Then they're going to worry about the health and safety of others who are around. And then they're going to um, provide you assistance. So there is a process. Again, they are, it's not like they're just going to come and jump right in. Like they need to make sure that they are safe. They need to make sure others are safe. They need to make sure they're safe from others. And then they're going to respond to you. Again, if you can walk, you're walking. If you can hop, you're hopping. If there is any way that you can assist in your own extraction, you are an active participant. If you can't walk, again, there is a process, and that process is time consuming. On this screen here, again, I have the I have this off-road vehicle with the no-no. Like, I put this here because do you think one of these low-lying hoopty, I'm talking like soupty hoopty car, that's how like these ambulance are road low riders. Do you think they're going to drive up the road to Colony Creek Aid Station at Sangre de Cristo Ultras? Those of you who have driven the road up to the Crestone Needles Trailhead up Colony Creek Road, no ambulance is driving up that road, and there are not lifted Jeep rated ambulances. There's fire trucks that they have for wildland fire, but that's not a vehicle they're bringing out for an athlete that needs emergent assistance out there. So chances are your search and rescue crew are coming in to find you on foot. And then also on the screen is a litter. I want to show you in my notes. I'll show you what the protocol for packing up a patient on a litter actually looks like so that you folks can see. Um, okay, I'm going to show you this. Let me get rid of my painting. Look at this. They got you on this backboard or whatever it is, and there's a specific protocol that they need to follow. And you're wrapped up here to the point that you're not going anywhere. You're not moving. If they accidentally slip on a rock and they tilt the litter while they're carrying you, you're not falling off of that thing. They need it. Look, it goes into great detail of how they are immobilizing you on this thing. And it's not quick, it takes time to do all of this. This is if it's cold. How are they going to wrap you up and make you warm and manage your temperature for a long walk out? And there's more how they wrap you up in this thing. I'm just showing you folks that. And then there's improvised litters. How do we do this if all we have is a tarp and some webbing, right? And a couple of sleeping bags? How do I make a stretcher out of sticks and some life vests? This is Here's how to make a stretcher using lashings. Friends, I'm telling you, if you need to be carried out, it is not a quick process. It takes a lot of time. So when I say to you that you need to be prepared in the event of anything out there, and what I say is like, don't wear short shorts. Let's say if Johnny Short Shorts was out during the race this past weekend, but he got hurt out on the course on the purple loop and he's 4 miles from the road and he's in short shorts. He could have been in very big trouble. And so for me, it's like if you just wear the right clothing, and if you're not going to wear the clothing, have it in your pack in the event that if something happens to you and you're going to be sitting there and laying there for any extended period of time, you are able to care for yourself. So hugely important and so very overlooked by countless trail and ultramarathon runners. For years, I have seen the packs that we wear, our running packs, get smaller and smaller and smaller. And all you need is a couple Cliff Bars, a gel, and some water. And you're good to go, kids. Off you go for a 30-mile run in the wilderness. No, you are a recipe for disaster. Bring the right gear, bring everything that you need in case something happens. That's it for my slides. Let me get rid of these. And we're going to get into more show and tell. I really hope that that helps kind of paint the picture for you on what happens. In the history of HPRS, I personally have directed 105 events. I've directed 105 events in my career. 104 of them are in the last 11 years. I have called 911 one time, and that was for two unaccounted for runners. The cutoff in that race was 11 p.m. It had been raining cats and dogs since 3 p.m., and the forecast was for temperatures to drop into the 30s and change to snow at higher elevations. And they were coming from higher elevations. At 11 p.m., they were unaccounted for at the finish line. I drove in my vehicle up this mud-soaked mountain to try to see if I could see them or hear them. I sent a hasty crew up the mountain calling their names. We had no headlamps, no anybody calling us back. We returned down the mountain, and at midnight, I called 911. Now, from the moment that I called 911 until the incident commander for search and rescue arrived was 2.5 hours. It was 2.5 hours before the first search and rescue personnel arrived. And again, it was the incident commander. He and I sat down at our central location, the start finish line, and I laid out my emergency action plan, the course maps, I pulled out our aid station tracking sheets so we can see the last time that we had a record of where those runners were at and at what time they were last seen at those locations, and then began to talk about where they could be. We began devising a plan for how we were going to actually get boots on the ground to go find those runners. And I want to tell you that the meeting time for the rest of the search and rescue personnel was going to be at first light. That would be 6:30 a.m. For 6:30 a.m., we had 50 personnel coming in. We had 8 ATVs. We had 2 helicopters on call. We also had a fire department show up with a drone that had infrared a camera on it so that we can look for heat traces of these individuals. And we were using that drone throughout the night in the dark, in the pouring rain. But again, from the moment that I called 911 until first boots on the ground, actually actively looking for those runners, was going to be 6.5 hours. So just imagine you're in an ultra marathon, you don't know how to read a map or use a compass. You go off trail, you lost the course markings or whatever happened. You go off trail and now you're lost. 6.5 hours until anybody came to look for you in a driving rainstorm, 30 degrees, changing to snow. This is hypothermia weather. Do you have everything that you need to take care of yourself in that situation for 6.5 hours? Now, thankfully, at first light, those 2 runners came out of the woods. We didn't need to dispatch anybody. They were found. This is my incident report from that situation. That is my incident report. It is an incredibly detailed recollection of events, including who each runner is, all of the information that I could possibly put into what I know about that runner. It also includes copies of the aid station sheets highlighted for where those were. It includes, you folks know I send out my pre-race emails via Constant Contact, and I can see if you opened and exactly when you opened those emails. I can see what time of day, what time of day. Did you use a mobile device? Did you use a desktop? What did you open? And then I can see what exactly that you clicked on. Our runner at Sawmill, who required the response, by the way, he broke his ankle in 3 places. He did have a broken ankle, broke it in 3 places, but had a good ankle and could have used the buddy carry to get out of the situation. But he clicked on the weather forecast, the Vapor Apparel upgraded shirt you can buy, the race website, and a Google map to show him where to go to get to the race. I note that that runner did not park where he was supposed to park. He parked within the park instead of at the carpool location, which tells me he didn't read any of the pre-race emails. He did not watch the pre-race meeting. I have the evidence of that right here, and I put that in my after incident report. So when I've got spouse telling me I need to improve my response time, for me, it's, oh, well, you guys need to do your homework too, because that also matters. And if you don't do your homework, this is where problems arise. So I offer that up as well, that when things happen, I actually do write the most detailed report possible. I do that for legal reasons. I do that for liability. I do that, and I also submit that entire report to every land manager that we work with on that event so that they also have a detailed account of what exactly went down, how we responded, and all of the tidbits of information that led to that situation. I told everybody to bring traction to this year's Sawmill Trail Runs. This runner did not bring traction. And he didn't bring traction because he didn't watch the meeting or read any of the emails. So because he didn't have traction, he slipped on the ice, rolled his ankle, broke it in 3 places. If he had had traction, if he had followed our recommendation, probably wouldn't have been injured. Okay. Here we go. show and tell. I know that's what you all came here for. Oh, in the comments, Tiara here has offered, I don't want to insult your intelligence. Thank you. You think that I'm intelligent. That's nice. But I'd recommend not using iodine due to shellfish allergies being a contraindication. Yeah. I also recommend packing rolled gauze or Z-folded gauze. If you can help you clean up a mess, you could probably get a few from any medical person that volunteers with you. Um, and she says, you care so much about this, and I truly appreciate that you do. Thank you so much, Tiara. Again, for me, I have the iodine because I follow my wilderness protocol. I follow my training. I'm not going to know if you have a shellfish allergy or not. And to your point, that could be an issue. Um, it's something that I can bring up with those who train us in these things. But we're not using 100% iodine. We're actually using very watered down iodine to help clean a wound. Me personally, I try to get by without using iodine if I don't need to. It depends on how dirty the wound is. For me, I would much rather prevent a terrible infection or not cleaning your wound, which could lead to deformity and to you not being able to, like, let's say you split your kneecap open and I don't clean that properly and I just pack it up with gauze and send you off and you get a bad infection. That infection could be bad enough that you never bend your knee right ever again. And hiking and running is not a thing. And so for me, I would rather clean that wound enough to make sure that you're okay. Um, and I'm getting you to definitive medical care as soon as possible. So for me, it's not, I'm going to clean you up, patch you up, and we're sending you home and la di da. No, it's, now you need to get yourself to urgent care. And so for me, my expectation is I am triaging you. I'm going to stabilize you and make sure you're okay enough to get to the next step in the medical process, which is getting yourself to definitive medical care. I am not definitive medical care. No race has definitive medical care on site in a trail and ultra setting. In every case, you need to get yourself to a urgent care or an emergency room or something ASAP. So if I'm going to use iodine and you're going to have an allergic reaction, I have Benadryl to help me with the allergic reaction enough to get you to definitive medical care. And so unfortunately, it's one of those things where I have to follow my protocol or you could sue me. So my protocol instructs me to use iodine to clean you. But I appreciate your position on this and the suggestion that you have, and also um, packing rolled gauze or Z folded gauze. I actually do have some of that in my first aid kit here. Most medical professionals who are volunteering at my events are not bringing me medical supplies to share with me. In fact, most times they are trying to avoid using their own medical equipment. They want to use mine because they don't want to have to replace theirs. Um, and those are great to have. Um, yeah. So again, uh, this is one of those moments where people want to challenge me on the certification that I've acquired. And I appreciate your time and I appreciate I'm following the protocols that have been taught to me and that I've been certified to use. Okay, let's get into show and tell here. Okay, so here's number one. What do we got? This is, let me use my painter. So I'm going to start with some miscellaneous injuries first. This one is in this area right here. And this is the red that you're seeing is just inflammation. And this is inflammation that is caused by dorsiflexion. So doing this. So this is let's say this is my leg and these are my toes. Toes up, toes up, toes down, toes up, toes down. On courses with a tremendous amount of elevation change, we see runners who get this inflammation and it may feel like you're never going to be able to walk again. It is an irritation of the tendons and ligaments here on the top of your foot, and it can hurt very badly and it can end your day. It's not life-threatening. It's not something where we're going to have to cut your foot off or anything like that. It's just irritation of the ligaments and tendons that are in this area. And all of these ligaments and tendons actually connect to your toes and then they run up your shin. And so the more that you flex dorsiflexion, the more that you do this, the more that you will irritate this area. This is Emily's foot. This occurred during a race where there were a lot of leaves on the ground, and she was having to pick up her toes to make sure that she doesn't stub her toe on a rock that she couldn't see or a root or anything like that. So the constant dorsiflexion of her leg for 100 miles irritated this area, and you're seeing the redness and swelling on the top of her leg. So again, this is from just you um, flexing and dorsiflexing your foot, stuff like that. Okay. Let's see. Next one I have is this guy. That's one way to make sure you don't have nipple chafe. I would say you could do this way, or you could just put some lube on your nipples and call it a day. But that's one way to protect your nipples from bleeding. It's better than nothing. Okay, this gentleman here, you can see some bruising. We've got a bruised toe, and the bruising continues throughout this area. I'm going to stop drawing. That's not what I want that to look like. Let's see. Let me try again. So it's like all through in here. And basically, I think what happened is um, we've got a I don't think this gentleman's shoes fit, and your feet were hanging off the edge of the shoe, or it's just trauma. It's just general trauma from running on shoes that don't fit. This is not a rolled ankle. I know that because there's no swelling in this area. If there was a rolled ankle or an ankle injury, you'd see definitely more in this area. It does look bruised right there. It could be a rolled ankle that the tendons that attach down here, but because we have this purple toe, that to me is showing me that this guy's shoes just don't fit. Could probably use a wider toe box. I see this a lot in ultras, just some foot bruising from the trauma of running. Also, I believe this was a temperature related injury as well, possible. And I think that because I can see a hand warmer pack here on the floor, and he's rested his big toe on it, which means he's trying to warm up his big toe. So this could be a cold extremity type injury. Okay. How about this one? Ah, yes, this gentleman. This happened at Silver Heels. He tore his LCL, lateral cruciate ligament, and he is injecting himself with lidocaine to completely mask the pain and continue running. He tore this tendon at mile 34 of a 100-mile race and continued to inject himself until he reached the 100-mile finish line. He did make it. He did finish. Um, he is a combat medic in the United States Armed Services. So who the hell am I to question his self-treatment of this injury? For me, it was like, all right, dude, you've served our country and seen enough shit that I'm pretty certain you know what you're doing. So have at it, buddy. And he finished and then went on to have surgery. There's a guy named Dave. Dave has the leans. Dave's core completely collapsed in on itself. This is what he looked like at mile 99 of the Mogollon Monster 100. You want to see a different angle of what this looks like? There it is. He's got the leans. And remember, in the last class, we talked about how some folks wonder if This is an electrolyte imbalance, but that has been disproven by Western states research. Now we believe that it is 100% core related. Dave has a weak ass core and just completely collapsed in on himself. When you get to this point, it's going to be really hard for you to get enough oxygen into your airway when that's the situation. Oh, what do you think this is? What do you think that is? I even have a close up. Boom. Yeah, Aaron, do more planks.
Animal bite or
That is a dog bite. Yes, this was a dog who had never bitten anybody ever, ever, ever. The sweetest dog in the whole world bit someone at a race. And again, this is me trying to be a nice guy. Sure, you want to volunteer? You need to bring your dog? Yeah, bring your dog out. That's fine. It's never bit anybody, right? Oh, no, sweetest dog, never bit anybody, never would. Yeah, well, sure did. And the runner here that this dog bit, this was this runner's second race ever with HPRS, and I've never seen this runner ever again. Uh, Again, my insurance does not cover dog bites. Dogs also bite other dogs. And if a dog cuts open another dog at one of my aid stations, I have a medical emergency. But it's not a runner, it's a dog. And typically, we then have to use resources reserved for runners to sew up a dog's wound so we can get the dog to urgent medical care. I'd rather not deal with any of that. So we don't. Okay, I'm going to show you the next one in a sec. Um, Again, I can't stress enough. I heard a story years ago of a spectator at an Ara Viper race in Arizona, the aid stations out in a wilderness area. Somebody brought their golden retriever to the race. Sweetest dog, has never bit anybody, not aggressive, never did anything. But all of a sudden, golden retriever jumped up on that spectator and knocked her over, knocked her back and over. And she landed in such a way that she broke her femur. If you folks don't know, breaking your femur is the most painful injury that you can have and remain awake for. She did require a helicopter medevac. That is a life-changing and potentially life-threatening injury. So she was placed on a helicopter and airlifted out of the scene. This is why we don't allow dogs. These are my legs after running in the Wasatch 100. All of the black that you see is because we were running through an old burn area. And that is just the amount of dust that got kicked up from me and all the other runners. And if it's on my legs, it's in my lungs. All right, we're starting off with the slow. Now we're going to get into some scrapes and abrasions. So we're going to be seeing some blood now. Scrapes and abrasions are not deep, they're not traumatic. You fell down and got a boo-boo. These are my legs after the Barkley. So those are all briar cuts. Briars, thorns, whatever you want to call them, thickets. This runner fell down and just got a nasty scrape. If I can zoom in. You see the black in there? That's dirt and grime and things that we really need to scrub out. And to Carol's point, I will try to use soap and water on this. This is a soap and water injury. I'm confident that I can use soap and water to scrub this out, but it's not going to feel good at all. It's gonna sting a little. There's another scrape and abrasion. Again, I would clean this with soap and water. No need to use iodine on this. Just an easy injury. We're going to clean that out as best as we can and then wrap it up. Another one, we used to give out a best blood award, and we stopped doing that because I felt like people were actually trying to get it, and our number of injuries started to increase. And after we got rid of the best blood award, wouldn't you know that the number of injuries we have at our races just decreased exponentially? But I want to zoom in on this one because you can actually see the dirt. You see all that dirt? So all of the black in this wound, that thing is filled with dirt. And we got to clean that ASAP. And I would also scrub this with soap and water. Not going to feel good? I have seen some medical professionals in a wilderness setting who have a toothbrush in their pack, like a soft bristle toothbrush to use in the scrubbing of that particular wound. I'm not kidding. Here's another one. You can actually see the dirt on this dude's knee. If it's here, you know it's in there. So another pretty good scrape. See what else we got. Here's some more. Those are some nasty toes, but I got better than that. Another scrape, dribble down the leg. No big deal. Clearly, this person has an issue with staying upright. We've got the rock tape over here with a band around the knee. This is a train wreck. Good times, everybody. This is a gentleman who fell. I'm going to show you another picture of his hand in a minute. This was at Sawmill this past year. We got an abrasion, a scrape there on his hand. If I zoom in on that, oh, come back. No, that's not it. Okay. There's like a flap of skin there. Right here, there's like a little skin flap. And I can see that underneath that flap of skin is actually it's actually dirty under there. And then you can see that his finger is swollen. Right there is some swelling. So we'll get back to him in a second. And what do I got? Oh yeah, this guy took a great fall. He's got it on the arms, he's got it on the legs. You can see how dirty his leg is. Another soap and water. Clean that up, soap and water. Probably won't. I don't have enough band-aids for this. I'm not going to wrap it in gauze. As long as the bleeding is stopped, we're good to go. G2G.
Bruh.
Okay. I promised we'd get back to that finger. So we can see the swelling. How about from a different angle? You could put a saddle on this one, Amy. That is a dislocated finger. How do we know? Well, he sent me the x-ray. There it is. And after they reduced it or put it back into place, that's what it's supposed to look like. Again, this is what it looked like. It's the only dislocation I've seen in 105 events, by the way. Good times there. All right, now we're getting into lacerations. I'm going to start easy. This is my hand. I almost lost a pinky at a race. This was at Sangre de Cristo. What happened? Well, I rolled an ATV down the side of the mountain, and this is what happened. I had these lacerations on my knee, the inside of my leg, on my finger, and a really bad concussion. I almost got crushed 3 different times by the machine in the 70 yards that I went down the mountain with it. And then we didn't hang any ribbons or mark the course that year. I had a pre-race meeting and let everybody know that that's what happened. So no ribbons. Good luck. Stay on the rainbow trail. All right, the next one is not for the squeamish. You ready? In 3, 2, 1. This is a lacerated kneecap. I saw 2 of these last year. That's one way that you can lacerate a kneecap. Here is another way. Another gory picture coming up. This is really bad. This is a trail runner's knee. I know this trail runner. You can see the fatty deposits of the knee, like underneath the muscle of your knee in there. I'm going to turn this off. The couple of kneecaps that I saw last year, Um, both of them needed stitches. Um, and that is an injury that I'm not going to use soap and water to clean. That is an injury that requires um, iodine solution. That is essentially watered down iodine to clean that out. I'm not going to use soap and water on that. I'm going to first irrigate using just regular water to see if I can get everything out of there. And if I can't, I might return to potentially using the iodine solution. And then I'm going to pack it full of gauze and wrap it up so that they are stable. And now I'm sending them to urgent care. And that is an injury that the runner most likely is going to be able to self extricate themselves. So basically, that means you're here, great. I've got you triaged. You're good to go. Get yourself down to urgent care. Get yourself to the emergency room. All right, the next one is also a gory picture. In three, two, one. This gentleman, this was at Sawmill when we used to be at White Ranch. This gentleman kicked a rock and Superman forward and planted his face onto another rock. And that rock that he planted his face in lacerated his face just above his eye. He required 14 stitches above his eye, and he required another 17 or 18 stitches on this part that's covered by the gauze. He's also an eye doctor. So it was, yeah, pretty ironic that the eye doctor. But again, you can see the grit and the dust and dirt that is here. Given that this is a deep laceration, I am not scrubbing this with soap and water. I'm going to try to irrigate with a syringe with water at first, and then I'm probably going to squirt some iodine solution in there, watered down iodine, to try to prevent infection. Cover it with some gauze and send him off. He also self-extricated, got himself to urgent care and taken care of. He actually came back to the race the same day to share the pictures with me. So, dude, true hero. Okay, now we're gonna move to on the dislocations and broken bones. We've had three. So again, we've had two broken legs at HPRS, both of them at whoa. No, we're not celebrating this. Facebook, whatever we're doing here. We had two broken legs at the Indian Creek trail runs over the years. Both times the runner fell into one of the culverts on the service road that goes up and down the middle of that course. They were 4 miles from the start finish line, and they walked themselves back to the finish line with broken tibias or fibulas, whatever it is. They walked themselves back in. Neither of those broken bones broke the skin, and they drove themselves to urgent care. And then at Sawmill last year, we had the gentleman who rolled his ankle so bad that he broke his ankle in 3 places. As far as I know, those are the only broken bones we've ever had at HPRS. I have a count: 3 broken bones, 2 legs, 1 ankle, 1 dislocated finger, 2 nasty falls requiring stitches around the eye, 3 falls requiring stitches to the knee, and 2 runners, both who self-evacuated for rhabdomyolysis. And then we have all of this other random shit that has happened and is pretty normal for ultramarathon running, like this. This is my foot from a race. We're going to lose a toenail here. I kicked a rock really hard. And then all of this red splotchiness that you see, this is edema. So that's just my body's response to having edema. And you can see that I clearly have a cankle. That's not the best cankle I've ever seen. This next one is. Boom. That is not broken. That is edema. Now I'm going to show you the other pictures associated with this foot. This is actually Emily's foot. That toenail is not going to survive. How did this edema come to be? Well, Emily finished a 100-mile race, and after she was done, she had a 2-hour flight home. And before she got on the plane, she put one of these Zensa compression recovery socks on her leg. But as you can see, these compression socks go from just below the knee to just above your ankle. And so she didn't have edema on her shin. It all settled because she wore this. It all settled from the ankle down into her foot. So what you're seeing is that's all the fluid that ended up below the compression sock. And I'm actually I can show you here. There's like the line where the base of the you can kind of see the striations from the base of the sock right here. So all of the edema in her leg wasn't in the shin, it was all down here. Okay? So now Emily wears full sock compression socks. Maybe her knee will swell up. Food for thought on these suckers. Okay. I have another edema picture. She's present. I hope you don't mind, Nikki. This is Nikki ran the Sangre de Cristo 200, and this is what her legs looked like at the end. Um, Now you would look at these are like, man, she got a 3rd-degree sunburn. That is not a sunburn. I know. I watched her put on sunscreen every time she sat down in an aid station. This is her body was legit crying. There's so much shit in our body. There's so many bad things that we need to push out. It is not poison ivy. It is not poison oak. This is serum. This is her body attempting to push out the bad things that are inside of her that they could that her lymphatic system could no longer send to her. It's right, lymphedema. That's right. And also, you can notice in this picture that Nikki was wearing some high socks. We have one sock line here. She changed her socks at some point. There's another sock line there and a sock line here. There's 3 different sock lines. So I would say if I look at this other leg, there's another sock line here. I can see another line here. There's another one up here. Nikki was changing the socks that she was wearing a few times, but most of this edema occurs above this sock line on both of these legs. So essentially, whatever, again, gravity wants all of this bad stuff to head downhill. And it reached the border of the top of her sock. And then it's like, well, I can't go downhill any further. So now I'm just going to start pushing it out. And that's why you have this lymphedema on her legs. Her body is legit crying for mercy and shoving all of the garbage out of her leg. It's one of the grossest things I've ever seen. Thank you so much, Nikki, for sharing that with us. Okay, then we have blood blisters. So here's a blood blister. These are not really that common. When I do see them, they make me chuckle. It's like a clown's red nose on somebody's foot. I can't find that. There you go. Okay, sorry. Okay, so I got another one here. This was at Sangre last year. This dude has a blood blister. He was worried that he was actually going to lose his toe. He had never had a blood blister in his whole life. And this guy was super worried that he was going to lose his toe. Blood blisters are not emergent, but they could be emergent. You got to be really careful with blisters, especially blood blisters like this, because you could actually poison your own blood if you decide you're going to pop this blister or take care of these, and then it gets dirty or something gets in there. So something here is telling us like this blister is actually deep enough that you are bleeding into the serum that is under your skin. And if you're bleeding into it, then you can receive things into your blood. And so in both of these instances, it's like go home take a shower, clean as best as you can, and then tackle it. So these are blood blisters. Now we're going to get into some miscellaneous feet stuff. These are just some nasty toes. I don't know. Some people would say that there's a big toenail there. I would say you're full of shit. That is not a big toenail. That's something else. I think this is probably the opposite foot for the same runner. It looks like the same grass. Some interesting stuff going on here. Obviously, we've had some wet feet. You can see the wrinkling on the top. Same thing, just some really nasty toes, nasty feet. Whoever that this is should really just go to the doctor and get those toenails surgically removed. They're no longer doing what they need to do. All right, we're going to move into maceration. Booyah! Well, there's a young Johnny. This is 2008 at the end of the Massanutten Mountain Trails 100. It rained and I never changed my socks and shoes. I just kept running. And this is what happens. I got this foot maceration. And I was telling you in the last class that typically right through here, this little crease, take that off. I'll show it to you again. Right in here, felt like the worst blister I've ever had in my entire life. And it hurts so bad that it will grind you to a screeching halt and you will no longer be able to run. So, but then you dry your feet out and there's nothing there. It's just unfortunate. So let me show you what this looks like from a different angle. This is actually trench foot. Very bad. And you can see there's like a line here where the edema kind of stops there, that irritation. It itched like hell. The following year, I ran the same race, and I had the same issue, but it was worse. When I took my socks off, the skin on the bottoms of my feet degloved, which means as I took my sock off, the skin came off with it. And I did not walk for 2 weeks while I babied my feet trying to grow skin back. I want to also show you, I'm going to come back to this picture and zoom in. I am so sorry. Okay. Unfortunate, I know, but you can see all of the chafe that I have in this area. That's not even the worst of it, but there is chafe in there. Also an issue. Okay. So I'm just trying to show you where I got the chafe on that one. Here's another race where I had bad maceration, feet wet for the entire race. I don't know why I'm smiling. I guess I was pretty proud of myself for being a massive jackass. This is not good feet. Again, I can show you there's that little skin crease, the skin fold. It hurts bad enough that you can barely walk. But it's amazing what you can do, even with feet like this. This is a guy that did Niwats, some more macerated feet. And you can see, I want to show you like inside these little cuts, you can actually make out that he's got dirt and grime and mud in there. This is actually probably a blister right here. Pretty nasty. Here, he's got like a foot mouth. Feed me, Seymour. I got a few more of these. Not my feet. Another nitwit. Okay, now the next one's the worst one. It is also a gory photo. Okay? In 3, 2, 1. Here's Emily's feet at the end of the Bighorn 100. Badly macerated. We have clearly a blister right here. There's another blister in here. I'm gonna show you this from another angle in a second, but yeah, somebody else that's really proud of how horribly they have destroyed their feet. What are we doing, people? This is the top of that foot. Emily clearly lost both of her big toenails. This is a blister that had popped who knows how many miles ago. Looks like one of those finger condoms just kind of hanging on for dear life, doesn't it? This is from the side. She's got a blister here. She's got a blister here. She's got a blister here. This is just the right foot. If you think the left one was better, no, was not. Okay, so here's a blister. I want to stop here for a second because what would I do to treat this blister? This is a Lancet. It's part of testing your blood sugar. You prick your finger with this. What I would do is use one of these and poke 2 holes into that blister and let it drain. And that is it. If I still have miles to run in the race, I'm leaving that blister alone unless the pressure is so bad that I absolutely need to pop that. But again, popping it, I'm just 2 very tiny pinpricks into that blister just to relieve the pressure and let it drain. But I'm not cutting it. I'm not cutting it open. I'm just putting these little pricks in 2 different places and letting it drain. And we want to keep that skin on there because the skin is actually helping to protect the raw skin underneath that blister. I'm going to show you a picture of what I'm talking about with the raw skin underneath the blister as well. So again, if I'm mid-race, I'm only just doing like the tiniest of pinpricks to get that serum to come out. But for the most part, if I can, I want to keep that I want to keep that serum in there because it's going to help healing, help protecting the blister. Okay. And I want to keep the skin as best I can as well. That's the one I'm using. Here's some bad heel blisters. This is from Niwatts. There's a top toe blister. Those shoes clearly did not fit me right. That's an odd place to get a blister. You can tell by the amount of dirt and grime on that foot that I did not take care of my feet. And that is what led to that blister. Want just a little bit of dirt and some moisture, and we're done. There's a heel blister that has popped. You can see where it popped right there. Another heel blister that has popped right in there. I got a lot of foot pictures, and I hate feet. Other leg, heel blister that popped. Pretty clean feet, though. So here's what it looks like if you remove the skin from your blister. Again, this is a runner who not only popped the blister during the race, but then peeled all of the skin off. And this is never going to be a recommendation. So that is raw skin underneath there, raw flesh. And because you've taken that skin flap off, it no longer has protection. And you can actually see that there's some dirt or something. I can't get it close enough. I can see it. There's some dirt or something inside of that. And that is not good. You want to keep these blister holes as clean as humanly possible. Here's another one. Blister popped Skin came off. We definitely want um, we definitely want to be using mole skin on something like this, which is going to bring me to that video that I promised how to apply mole skin. Let me see if I can get this guy. Okay. See if I can share my screen. Here he is.
We're just getting started, but I'm going to show you why you go out prepared. I think I've mentioned in other videos that you always carry moleskin. We already got a heel rub problem on one of the compatriots here. And if you look, you can see it's already starting to rub maybe. Anyway, I'm going to show you what you do. You got your moleskin. We've kind of figured out the size we need. And you cut out the spot where the actual blister is, because you don't want it on the blister. I made that a little big, but that might be about right. All you're doing is you're creating a cushion for this to keep your sock and your heel off of this, like the heel of your shoe. But I carry these pre-cut moleskin pieces, and then you just cut it to size. I made that a little bit big by accident, but it'll do the trick. Well, let's see. That dude on there. So you sock up and should be good to go for the rest of the trip. Always, always, always have moleskin if you're going to hike, because you never know when something's going to break down in the heel of your shoe, and a little piece of, I've had little pieces of plastic start to come through, and it doesn't matter. Like, so moleskin is a must, and that's how you.
Why do the bald guys have the best beards? Something I've always wondered. Anyway, that is the proper way to put moleskin on to protect that blister from getting even more rub from whatever's rubbing on it. So you're essentially adding a layer of protection between whatever it's rubbing up against and the blister that's already forming. Okay. Couple last things. What do I carry on my first aid kits? I've got this little guy. I also have this guy, and I have an even smaller one. So I've got like, this is my biggest, smaller, and then even, well, it's similar, but smaller than that. But they all have bandages and dressings, tape, um, different types of band-aids in there, cleaning and topical ointments, ibuprofen, antihistamine, afterbite, sting, and itch relief wipes. They have moleskin, pre-cut and shaped, alcohol swabs, a safety pin, and a splinter picker tick remover forceps. All of the things that I have in my race director bag. All of these first aid kits that I have, this one also has a roll of duct tape in it. It also has some new skin. I think I added these after the fact. But same things. They all have the same things inside of them. Um, I also might have a pair of waterproof matches with me or flint and steel so that I can start fire if I need to get warm. An emergency blanket. These are actually packed much smaller nowadays. This is what I might put my medications in. It's a thing that you would squeeze. I also keep some of my meds in an actual old pill bottle, and I have a smaller one than that. My foot care kit has those Lancets in it, moleskin, butterfly bandages, and some of that stuff that the tattoo artists are using. And I always have an emergency poncho, works as a vapor barrier. That's what I take with me. That is all that I have for this evening's class. 9 minutes shy of go time. Thank you, everybody. I appreciate you all being here for these. Fixing your feet. Highly recommend this book. Again, I could talk for hours about fixing your feet, but this book does it for me. So I'm going to recommend this. John Von Hoff. This is the 4th edition. He's probably on the 6th or 7th edition now, but this gentleman is a podiatrist who is most known for being the lead foot guy at Western States 100. This is a book he wrote about fixing your feet. I cannot recommend it enough, especially if you're one of those runners with chronic foot issues at races. Thank you so much for joining me for this clinic, everybody. I hope to see you at another one coming soon. And that's going to be the end of this. Thank you so much. Appreciate everybody. Stay safe out there. I hope you learned a lot. Send me an email if you want to. I'd love to continue some of these conversations. Especially you, Tiari, and Carol. Please email me so we can discuss some of the cleaning things a little bit more. We can learn from each other. I think that'd be great. Appreciate all of you. Thank you so much. We'll see you next time.